Health Spotlight, presented by Community Health Network.
Welcome back. One clinic is finding the balance when treating organ transplant patients diagnosed with cancer. News 8's Lena Pringle has the details on the new approach redefining healthcare in today's Health Spotlight.
Studies have shown that organ transplant candidates and recipients are 4 times more likely to have an increased risk of developing cancer. Those patients face multiple doctors and diagnoses, which often conflict with each other. Now, there's a new clinic, a first of its kind, that's developed a new unified approach to treating patients. Dr. Christopher Blosser is on a mission to redefine healthcare for transplant patients diagnosed with cancer.
People have a much higher risk of cancer in the setting of organ failure or organ transplant. And oftentimes their care is fragmented or siloed.
Siloed is referring to the different doctors a patient will see for each diagnosis. Typically, the physicians don't consult with one another, which can lead to conflicting treatments.
That doesn't provide the best chance for them to do well.
And that's why Blosser created the Cancer and Organ Clinic, a collaboration between the Fred Hutchinson Cancer Center and the University of Washington in Seattle.
The Cancer and Organ Transplant Clinic is the first of its kind multidisciplinary clinic that provides personalized care for people who have cancers before or after an organ transplant.
Both a cancer specialist and transplant doctor meet with the patient to determine together the best course of treatment. The results have been transformational for patients. Blosser also created, in conjunction with the clinic, the Center for Innovations in Cancer and Transplant, which has
the only patient-level national registry to address why people develop cancers to a greater extent in the midst of organ failure.
Bringing us one step closer to the next medical breakthrough. The Cancer and Organ Transplant Clinic aims to reach as many patients as possible outside of its Seattle area through telemedicine. For his part, Dr. Blosser is licensed in Washington and is in the process of becoming licensed in other states, including Alaska, Montana, Idaho, and Oregon. He says the more people they can reach, the better. I'm Lena Pringle for Wish TV, wishtv.com, and like us on Facebook.